Yeah.
Dr. Neville Graham, where are you at the Caribbean School of Medical Sciences, Jamaica, on this continuum of the Blue Ocean strategy?
Yes, and I must say that I read the outliers first. And then I was introduced to Blue Ocean, and you looked at it. But I want to say a very important thing about myself is that my experience at Port Antonio, KPH, Kingston Public Hospital, actually caused me to look at what is it that we can do for people who really suffer and are in need of help, especially medical care. So right away, I decided to dedicate myself and my life to medical care, to improve people's lives, to help people, and therefore look at it not only as a duty, but also as a business. Now, here is it that you have to think now the Blue Ocean strategy. So the first thing happened, and I have my colleague, Dr. A. King here, who we worked at KPH together. A. King? Now, the key thing is that when you are in a situation like that, and you have to choose between a very ill person with cancer or someone who has to go back to work but has a large hernia or a gunshot wound, and perhaps that person is an excellent person or a criminal, but the gunshot wounds take that precedence, and a lot of times you have people with hernias for up to 3-4 years looking for help. And thus, when I went to Edinburgh and saw what happened, right away, it touched me, Winchester. And so, work, Winchester is a possibility where the cost is not so high. It is an ambulatory surgery. People can come in and go away, pay less than if you were at the big hospitals and you create help. And that is a way of the Blue Ocean. But then you came up on another problem. You can solve that and no more. Because in this country and in the world, you have so much doctors, so much healthcare workers to a large population. And the World Health Organization, and that is where research comes in Blue Ocean as well. Because when you do the research, you find that you have a need for 2.2 million doctors, 3.5 million nurses, 1.5 million dentists, Dr. Edwards, 1.5 million pharmacists, who would only, and another 4 million health workers who would make the world just 80% in terms of adequate health care. And you wonder, why didn't we have more doctors? But not only that, where are those doctors and nurses needed most? In areas where there is low income level, in countries where you have very poor people. And so you now say, okay, I was looking at that end of the picture, but what about solving the problem with education? And thus, here comes the question, how do we do it? So we come up and we look, even Jamaica. If you go to Children's Hospital, many mothers will have to stay up to 24 hours trying to get their kids in, right? The University of the West Indies is doing its best. But also, when you look at other people all over the world, and when you look at even what happens in the United States, you have a United States that needs 20,000 doctors per year more. And you look at the Caribbean, and you realize something very important. Here is it in the Caribbean. We have over 40 odd new medical schools in all the Caribbean islands, literally. Jamaica just started to look at outside of the University of the West Indies. But Jamaica and Cuba are the best placed places for the training of doctors and health workers. Why is it so? Why is it so? Cuba, by its own organization, and proven by the respect of WHO, has actually 5,000 doctors per year they train. But when you look at Little Grenada, that does not have the capacity for clinical care, trains up to 2,000 doctors per year. And when you look at who own those medical services and medical schools, they are owned by foreigners, basically, except UWI, that is public. So therefore comes in the Caribbean School of Medical Sciences. We have the teachers, we have the clinical space, we have the ability to do so, and so we have the bright students too, and we have the patients that need that service. So the Caribbean School of Medical Science fit in to deal with a particular situation. But not only that, here is it. The United States medical license exam actually allows, when you pass that exam, you can work in nearly 80% of the countries in the world, including those countries that need the help the most. So you have to use another strategy, public-private partnership, partnering with the community, partnering with other countries, especially those partner with communities, partners with colleagues who know that that service is needed. So the Caribbean School of Medical Science create an excellent opportunity outside of the normal stream of things, and now creates a condition for more opportunities for young people, and yet still greater opportunities for our patients. So that is why the Caribbean School of Medical Sciences is one of those outliers, one of those blue oceans approach to medical